everyone. My name's Maddie. I'm one of the nurses here at Glick.
And my name is Jessica, and I'm a community health worker here at the Gerald L. Ignace Indian Health Center.
And today we're going to talk to you a little bit about the importance of colorectal cancer screening and awareness. So, colorectal cancer is actually super common among Native Americans.
Colorectal cancer is the most likely to affect men and women in our community over the age of 50 to 75.
Native Americans are often diagnosed with colorectal cancer at later stages of the disease when it's harder to treat.
So first, let's talk about a couple of things that we can do to prevent colorectal cancer.
So a few things. One, we can quit smoking, increase our intake of fruits and veggies, and focus on our weight control.
We should try to limit our alcohol, exercise, and be screened.
Two of the most common screening exams for colorectal cancer are the fecal occult blood test, or FOBT, and fecal immunochemical test, or a FIT test. And then we also have a colonoscopy.
So let's talk a little bit about the FIT test that we can take home.
So this one is super safe, available, easy to complete, done on your own in the comfort of your own home. And we're going to just kind of demonstrate how you would do that. So if you're going to have an FOBT ordered by your provider, we would, one of the nurses or the medical assistants would come into the room and show you kind of how this is done. It comes in a paper bag with all of the supplies that you need, some extra like information sheets, pair of gloves, and then you'll take home what's called a hat. So you'll place this hat on the toilet, and then you'll use the bathroom. And once you have the stool in this hat, part of the kit is this little tube, and it's pre-labeled with your name and your date of birth and like your chart information. So you just unscrew it, and then at the bottom there's a little coil part. And for this coil, you're just gonna lightly press into the stool. And you're gonna wanna go in 6 different spots, just very lightly. You only wanna do the tip of this coiled part, and you don't wanna actually scoop up any kind of chunk of the stool, because if you have too much, then we actually can't run the test. So once you poke 6 different spots of the stool, you'll put it back in here, screw it on, and then we have this pre-addressed envelope. Place it in there, seal it shut, and then you can pop it in the mail here back to the clinic, or if you're coming to the clinic, you can drop it off.
And there's a couple of informational pieces that you'll be receiving as well, so take some time to take a look at all of this information as well.
So this is the FOBT, kind of like the easy do-it-yourself at home yearly screening. And then the other one is the colonoscopy. So the colonoscopy is something that kind of takes a look at the entire colon, and it can find most cancers or polyps that are present at the time of the test. And as long as no polyps are found, this can be done every 10 years.
So we encourage you all to do a colonoscopy or to do a FIT screen. You are our future, so we encourage you to come in, speak with your provider, get your referral to do your colonoscopy, and get that done. Thank you so much.
Thank you.